let's just start, if you don't mind, with when it was that you realized that circumstances were going to force some major decisions to be made, some major actions on the part of county government.
Yeah, so I remember we were tracking this a little bit in the months before everything was shut down. Our health department was kind of like telling us a little bit about COVID, but to kind of illustrate how quickly things happened, I think I had a State of the County address at the Oakdale Commons in like mid-February, maybe late February, and I didn't even mention COVID. And probably 3 weeks later, everything was shut down. So trying to remember, I think that there might have been a case in Tioga County that we saw, and started to get really concerned that it could quickly overwhelm hospitals. And but yeah, it went from me not mentioning it all in my State of the County address, and 3 weeks later, just about everything is shut down across the country.
So in those early days, and I think I have a fairly good handle on this, but what would you say were the key areas of concern for county government in those early days?
I think the biggest concern was the hospitals being overwhelmed, the ERs being overwhelmed, and not being able to handle the patients. And of course, the county runs its own nursing home, but we also have other nursing homes. So there was a real concern about that being the most vulnerable population, hitting people. And so I remember when schools were shut down, and trying to, we had interactions with school districts through the county, but not a whole lot. The county just doesn't interact a lot with school districts, so we had to learn a lot of things. And I remember when the schools were shut down, we had to quickly figure out how do you then provide all the meals that the schools were providing to kids, because a lot of kids, like over half the kids, got their meals from the school. And so having a lot of conversations with all the school superintendents about how are we going to help assist schools, and making sure, I think we built out over 40 or 50 different food sites across the county to make sure people could still pick up, breakfast and lunches, things like that. A lot of it was in the early days about just the coordination, because things are shut down. You're not going to have certain services. How do you help? Ordering PPE was a huge thing early on. There just wasn't that type of stockpile there for a whole bunch of PPE. So our emergency services was really instrumental. At one point, I think we had a whole. We were actually asking for people if they had N95s in their basement, because they were doing a painting job that maybe they didn't do, and there was an N95 there that hadn't been opened out of its package, if they could drop it off. And I think at one point we probably collected about 1 million pieces of PPE and then distributed that to hospitals and nursing homes here. So a lot of it was trying to get supplies that just didn't exist readily. We would have the sheriff's department. I remember there was a road patrol deputy that would drive up to Albany. If we could find 50 tests, we'd send them up to Albany and grab the tests and bring them back. And of course, give those tests to the most, the areas which needed it the most. I mean, when you think about 50 tests, I think years later, the federal government gave you 50 tests, right, in your mail. But back then, just getting 50 tests was a big deal. And then just the county, later on, the county coordinating the mass testing sites. We set up a mobile testing site, and then we created a mass one. And then later on, when the vaccines arrived, setting up mass vaccination sites, working with the health department and the Office of Emergency Services. Those kind of like large-scale operations were really important and were run out of a couple of county departments.
Yeah, I remember the desperate need for testing. That it seemed at the time that there was so much unknown and there was a fair amount of fear. And testing seemed to be the one thing that could help provide some data points, some understanding, and then also, make sure that people carrying the infection weren't in places like hospitals or nursing homes.
Yeah, a lot of people were afraid early on, and one of the things that we wanted to do was we gave a lot of updates to the public, and as best we could understand the information that we had at that time, we were trying to relay information to the public to help the public out. And probably by the second week of COVID, the state had really taken control. I think after the first couple of weeks, the state had taken full control over the response. I mean, there was still a lot of stuff that we had to do in terms of coordination of resources and things like that, but a lot of what we did after the first 2 weeks was also in our updates, we would get an update from the governor, and then the governor would, we would typically have a meeting with these by region with governor, with state representatives, and they would kind of like inform us, okay, this is what's going on today, this is what the governor's doing today, and then we would have to find out, like, what does that actually mean to Bourbon County, and then explain that to people right after that. So oftentimes, people would listen to the governor's update, and then they would listen to my update, and we tried to stagger those updates a couple hours later, because literally sometimes we were finding information out as we were hearing it from the governor, and then we would have these coordination meetings and ask as many questions as we could, because sometimes we didn't understand all the details, and then we would try to get that information out to the public.
Was it a situation where initially you didn't necessarily intend for it to be a daily briefing, but every day there was something worthy of going out there to a point where you suddenly realized, well, I guess this is a daily thing?
Yeah, that's exactly how it happened. And of course, we didn't realize, again, we didn't know this would last, how long it would last for. Was this going to last for a couple weeks? Was it going to last for a couple months? And in a way, it lasted a lot longer than that. And of course, with different levels of rules and regulations and things like that. But I think a lot of people were fearful. There was a lot of fear in those first couple months, and there was a lot of changes too, because schools were shut down. So parents were struggling with kids learning by Zoom at home, and I think school districts did the very best job that they could, but there's a big difference between your kids going to school and learning than your kids just staying at home and hanging out and learning, and supporting people throughout the different phases of the epidemic. I mean, the county, we were dispatched with making sure that when all the businesses started to go back to being open, they often had to go back to being open with certain rules attached. And we had to make sure that we gave businesses and schools the information that they had to have to be able to reopen.
Seemed also like there were various times when you were called upon to kind of pivot. For example, early on, and a lot of this seemed to come from the governor, there seemed to be this paranoia about running out of ventilators.
Yeah.
And that seemed to be a huge concern on the local side initially, primarily anticipating the problem that ultimately I don't think ever really occurred. I don't think we ever ran out of ventilators.
We didn't run out of ventilators, but that was part of the fear, was that the concern was, COVID obviously hit every place in the state and across the country, but it certainly hit different places harder. But there was some real concern that our ventilators were going to get taken away when we needed them. And, I remember the governor saying that he was going to come and, if he needed ventilators, he was going to take them from different regions. So from time to time, we had to push back on those types of things. Thankfully, we never ran out of ventilators or anything like that. And just like with schools, I was probably talking to Kathy Connerton and John Carrig probably like 5 or 10 times a day, constantly texting, especially in those first few months, in terms of like helping out hospitals and things like that. And part of the updates were to reassure people. There was a lot of rumors going on about different things that were not true that could typically start on the internet. And I think I remember there was one rumor that black helicopters were coming and landing on the top of hospitals and taking all the ventilators, and certainly that wasn't happening. So part of it was to kind of dispel some of those rumors that did, understandably scare people, but kind of like get the factual information out to people.
Yeah, I remember a moment at which, there was all this concern on the one hand with the hospitals being overrun, but then suddenly there was a concern that people with legitimate medical concerns weren't coming to the hospital and perhaps making their conditions worse.
Yeah. So that was information that we had to get out to the public as well, that, the hospitals and the county kind of collaborated on to tell people that, if you are really sick, yeah, you should come and get checked out. And unfortunately, not everybody did. So there was a lot of conditions that people had that did not go checked, and people got sick because of that. Although I could understand why people would be wary about going to hospitals when they had 80, 90 people with COVID and in the ER, why they would be suspicious about wanting to, reluctant to want to go there.
And then another concern for the hospitals was their workforce, which obviously was exposed in many cases, but then also many had kids whose schools and daycares were shut down.
Yep. So we had that issue with hospitals where, even if you were within, if you were traced and you were found to be within a certain distance with somebody that had COVID, you were also then put into quarantine. Certainly if you had COVID, you couldn't come in and work. And that was one of the things I think that hospitals struggled with most. And we did as well in our nursing home when COVID would go through. Obviously we knew that there were staff that, whether it was going into our nursing homes or our hospitals, that could be coming in with COVID that wouldn't even know that they had COVID. They could be asymptomatic and then unknowingly bring it in to the facility. So just having people put into quarantine that didn't even have COVID, or people who did have COVID, it was a huge strain on hospitals. A lot of hospitals, along with nursing homes, and our nursing home had to go and bring in a lot more agency staff to supplement their regular staff that that weren't there because they were sick or they were quarantined. And a lot of the daycares were shut down. In fact, the county set up their own daycare. We took the Broome West Senior Center, understanding that nurses, doctors had kids, first responders were still going to have to work. These essential workers were still going to have to work, and we set up a daycare that was approved by the state. That ran right out of our Broome West Senior Center, run by people from the Office of Aging, who did a wonderful job with it. I don't think they ever thought, working for the Office of Aging, that they'd be working with little kids, but they were great at it. And that's the other thing that I would say that we saw as like county employees stepping up and doing things that they've never done before. Like one of the big things that they had to do was contact tracing, making all those calls. So many of those calls were made that I think played a pretty big role in at least stopping the spread like very quickly and inundating hospitals, that people knew that they were exposed. They had that information. And we had people from the arena making contact tracing phone calls and other different county departments as well. So it wasn't that the health employees, the OES employees really stepped up, but a lot of county workers had to do things that I don't think they ever thought they would be signing up for during COVID, and we certainly appreciate all the work that they did with that.
I know I said we would focus primarily on the early days, and this maybe emerged as a concern a little bit further down, but I recall a lot of talk about worries over sales tax revenue from all the shutdown.
Yeah, so we had two major issues with revenue. Sales tax was down because simply I think we had to kind of compare and contrast, during the height of COVID, we had a 17% unemployment rate. That's almost like Great Depression levels, simply because of all the businesses that were shut down. Like today, we have a 4% unemployment rate. So when so many people are out of work, so many businesses are going to get shut down, you lose a lot of money in sales tax. And sales tax is like the lifeblood of governments. Certainly we have property tax that is pretty stable, but sales tax can swing, and it really swung certainly this time. But the real revenue issue that we had was that the state also had issues with revenue, and we probably had, I would say, at least $20 million withheld from us for a very long time during COVID from the state. Just money that we had that we had due coming back to us from the state in the form of reimbursements for programs that they were to reimburse us, and they just put a hold on all that money. And we finally got it back. So, but we went, a pretty long time. I want to say for the better part of a year, having $20 million withheld from us. Sales tax, I think sales tax was down like, it was like $3 to $6 million. It was down during that time. And of course, other municipalities, we share that with other municipalities, so that was hurting them as well. So it was a difficult time financially, but what we were surprised is that when the businesses reopened, and this could be due to many things, right? The stimulus payments that people got, just the fact that people finally got to go out, and they were just like, really taking advantage of that, and because they knew what it was like not to be able to do that. Our sales tax revenue went through the roof in the years later, and it's still doing well. It certainly has dissipated from those first couple of years after COVID, but our sales tax was up 10-12% each year for the next couple of years after that. So there was a really nice rebound, but not having $25 million is certainly a difficult thing to get through.
Let's talk just a little bit about how this impacted your day-to-day in those early days. I've got to imagine longer hours. I think I heard at one time that you and Kevin were kept segregated so that you wouldn't expose each other. Should one of you, and that perhaps there were other efforts on the administrative side to sort of have a second, set, that sort of thing.
So we were, we were. This is like everything was kind of put off. I mean, we had other operations that we had to do with the county, but we quickly moved out of the downtown offices, and we figured out that we had to do everything out of the Office of Emergency Services because that's where a lot of things were directed out of. We treated it as a flood or anything else. It was a state of emergency, and when we have a state of emergency, we all come to the Office of Emergency Services. After about a week of meeting there, we kind of looked at each other and were like, why are we all getting together talking? This doesn't make sense. I mean, people could get COVID, they could get bounced out. We didn't really have Zoom up and running at that point the way we did a little bit later on. So we actually had two different teams. There was the main team at the Office of Emergency Services, where myself and my health director, Rebecca Kaufman, and then the former emergency services director, now my deputy county executive, Mike Panicello, would work with our team there. But then there was a whole separate team that was in the health department that had the deputy county executive and the deputy Office of Emergency Services and the deputy health director there in case there were COVID outbreaks at the Office of Emergency Services, and all of a sudden it bounced us all out and we were sick, and we had a kind of a backup site where our deputies, if that ever happened, would be able to run things if we weren't, able to run things. That never happened, but yeah, it was a little bit different because I think for months I didn't see certain people that I had seen every day in person. But we were probably there like OES, we were probably there from like sometimes from 8 o'clock in the morning to 8 o'clock at night. And you get a lot of phone calls after that. I mean, it was a constant stream. I mean, businesses wanted to know what was going on, totally understandable. Schools wanted to know what was going on. State calls, federal calls, local governments wanted to know what was happening. And I mean, during this time, we just got inundated with tons of calls. Like the call volume coming into our office was tremendous because people just, certainly had all these questions that they needed answers about. And so it was a lot.
Not that this is a bad thing, but do you think the fact that your profile was raised by those daily briefings only added to the calls?
I think so. I don't think county government's an interesting thing. We do a lot of different things. I think people who know county government understand all the things that county government does. But I think people typically tend to identify more with like the city they're from here in Broome County as opposed to what the county does. And I think one of the things that COVID did was it illustrated much more what the county does. We have, our health department is critical in in dealing with all different types of diseases. The Office of Emergency Services is the county department that gets activated, whether it's a flood or a winter storm. It certainly got activated during this time. So I can definitely say that people realized all the different things that county government does more than they ever knew before as a result of all the things that were now being highlighted because of COVID.
Did you find your own personal profile increasing?
I mean, some people knew me when I went out before this. Like I go out and do grocery shopping or something like that, and I think because I didn't realize this for a while, but some of the news was like breaking into the soap operas when I would give an update, and I didn't know that. So a lot of people. A lot of people, looked at me totally differently afterwards because, they were seeing me instead of, The Young and the Restless or, Guiding Light or something like that. So I think more people knew, certainly more people knew who I were after COVID. And, I'll come up to people and they'll still come up and say, oh, I remember you during COVID. And I, what I say back to them is I was more the messenger. It was like all the, people that were figuring out how to do mass vaccination sites were the health department and Office of Emergency Services and the sheriff and all those people that did that stuff. Not necessarily, I wasn't coming up with all those ideas. We were just all working together. But I think if you didn't know what county government did before COVID, you certainly knew a lot more of what county government does afterwards.
I heard a lot of people express appreciation, though, for the fact that you were at least trying to put out information, even if often there were questions you didn't answer.
Yeah, we try to, and I think that was the thing that I think people listen. It was a really scary time in our nation's history, and I think a lot of us did know somebody that died of COVID or went through a really tough time during COVID. I mean, I remember giving updates when we would update deaths and things like that, and that was really hard to do. And a lot of people lost loved ones because of that, and so people were certainly really worried about it. And what we wanted to do is just be we just wanted to give out all the information we knew at the time for people, because I think that comforted people. I think during a time of crisis when people aren't saying anything, that's what gets people really scared, and then they let their your worst fears are you can run with your worst fears. But our job was just to sit down and get all the information that we knew that day, all the information that we knew that the state was doing or the federal government was doing, and then communicate that to people. And I think it was helpful that people, had somebody locally here that was kind of like digesting the information and saying, okay, this is what's going to happen. This is what it means for Broome County. Because it's one thing for a governor to say that, or like the president to say that, and kind of, watch the news and see that. But people really want to know, well, what can I do? Can I go to my church? Can I do this? Can I do that? Can I go to can I go outside? And they had a whole bunch of questions. And I think having local people respond to people and update them on things was helpful for people, and a little bit more comforting that this is somebody from the community and who was talking about the community that people lived in, during this kind of scary time.
So acknowledging that you were essentially building the plane while it was flying.
Yeah.
Looking back, are there things you would do differently now in hindsight?
Oh, I don't know. I'm sure we, I'm sure we, we did things looking back on hindsight that might have been extreme today. Like, I think we shut down the bus stations, and the whole concern about that was that there were places in the state that had like really high infection points, and we just said, okay, we're going to shut down the bus stations, and nobody's going to come up and nobody's going to come up to Broome County on buses, and was you could probably look back on that and say maybe you didn't need, maybe that didn't need to happen. Those types of things didn't need to happen, but I think the concern, what I didn't want to have happen is I'd rather err on the side of helping people, making sure that hospitals didn't get overwhelmed, as opposed to just not doing anything and letting something happen. And none of the decisions that we made were without talking to school district administrators or hospital officials or people in the health department, or and trying to get the best information from the people that were the experts at the time. So I'm sure there were things like that you could look back on and say, you probably didn't need to do that. But when you're in the first weeks, it's like the fog of war, right? In the first couple of weeks, first couple of months, you don't know what could happen, especially in a pandemic. And in a place, Broome County is an interesting place because we do have a more, like percentage-wise, a more senior population, and those are the people that were more likely to get the worst effects of COVID. So those were we had a heightened concern about it.
A lot of news these days about the avian flu, and should it ever get to evolve to a point where it's easily transmissible between people, are we well prepared, better prepared?
Well, we're a lot better prepared now. I mean, the last real pandemic we had was way back in 1918 with the Spanish flu or whatever, and so being on a lot of the same people that were with us during COVID and made decisions, whether it was at the county level, the school district level, or the hospital level, nursing homes, they're all still there. Most of them are still in those positions, and we have a much better understanding of what works, what doesn't work. We, if there's a need for testing, we know how to allocate resources and test a lot better than we did 10 years ago before COVID started, and the same thing with other operations like doing vaccinations and finding the best way to vaccinate people for the people that want the vaccine. So having that experience has certainly helped us prepare for any other pandemics that are going to come our way.
I guess I don't want to end this interview without, acknowledging the people who did lose their lives and the suffering. And I give you credit. I don't think you ever lost sight of that in your briefings.
Yeah, we it was hard to talk about because these were people that lost their lives because of a pandemic, and I often took very personal responsibility for it because I felt like I was, I'm the person here that's supposed to be managing this epidemic. So when somebody would die and we get a report of the death, it was a hard thing to take. It was not an easy thing to take, and it wasn't just the the deaths were the worst thing, but it was also there are a lot of people in nursing homes that couldn't see their loved ones for a very long time. So I thought it was terrible that you had loved ones that kind of had to I remember at a point we had iPads set up where they had to FaceTime each other and they couldn't see each other in person, and I think we're still dealing with the effects of kids in schools that didn't go to school for the rest of that year, and that's why when we reopen things, we want to be the quickest to reopen. When the state's like, okay, you can reopen schools, we're all over the schools and said, okay, we're going to do everything we can to help you. Here are all the things that the state's saying to get set up. Let's do it. Same thing with all of the other places of business, nursing homes, all that kind of stuff. But I think those were the things that you can never get back, right? Like having somebody in a nursing home and not being able to see them for a long time and not having that connection, or a student that lost the better part of half a year because they couldn't go to school and get that help. A lot of kids with disabilities weren't able to go and get the services that they needed during that time. And I don't think that's a kind of a permanent loss. Certainly people dying is a permanent loss, but then people who are still living, I think we're still dealing with some of the effects that COVID had with isolation of people. There were a lot of there was increased overdoses because people couldn't get the support that they needed to get, and we're still dealing with some of that stuff, just 5 years later.
Do you think ultimately, though, the way in which the county responded should give folks some faith in the ability in a crisis for all the folks, not just you and your floor here, but everyone that had to be involved in this response?
Yeah, I think it should. I think COVID has become a little bit more political these days. When people think about COVID, and it's become a little bit more political. But what I will say is, and it was hard for people to see this unless you were actually working with the people in government. But the people that responded, those Office for Aging employees that took care of all the nurses' kids and the cops' kids and the doctors' kids, were amazing, and all the employees that went over and did contact tracing, and the people that worked in emergency services and the health department, all the really great work that they were doing. It was really pretty amazing to see employees do that. So if you can kind of remove yourself from the political part of COVID, how county employees stepped up was nothing short of amazing. And we've seen this happen before, right? Like in floods, you see people step up, not just government employees, but people from all across the community, and just really respond in an amazing way. And that's what I saw. And that was really pretty wonderful to see people step up in that way.